If your blood pressure refuses to come down, even after medications, diet changes, or exercise, you may be missing one critical nutrient. It is not a new drug. It is not some trendy supplement, but it could be the key to protecting your heart and lowering your stroke risk fast. So what is this game-changing nutrient? Stick around, the answer may surprise you. Hi, I am Nicholas, a pharmacy practitioner, and I'm passionate about helping you to take control of your blood pressure naturally and safely. Blood pressure is one of the biggest risk factors for heart disease, the world's #1 killer and stroke. But here's what most people don't realize. A specific nutrient deficiency could be quietly sabotaging your blood pressure, and that nutrient is potassium. Before you even consider medications, it is crucial to get this right. You may not need pills at all once this is addressed. But how much of a difference can potassium really make? Let us dive into the research, okay? Two kinds of studies show us just how powerful potassium is. First, let us look at what happens when people don't get enough potassium, okay? In one study, men with normal blood pressure were split into two groups. One group consumed a normal amount of potassium. The other group's intake was drastically reduced. What happened? The group with normal potassium intake maintained stable blood pressure as expected. But in the low potassium group, blood pressure shot up significantly after just 9 days. Another study looked at people who already had high blood pressure. Again, one group consumed normal potassium levels while the other had very low intake, okay? The results were striking. Those with low potassium saw their blood pressure rise by about 5 units. These studies clearly show that when we don't get enough potassium, blood pressure rises very fast. If you are serious about managing your blood pressure, tracking your heart health, and staying active, this smartwatch is a total game changer. It is designed for both men and women, and it goes way beyond just telling time. Here is what it tracks: 24/7 blood pressure monitoring, heart rate and blood oxygen levels, sleep quality, steps, and calories burned, all in one sleek waterproof fitness tracker. That's right, it is 5 ATM waterproof so that you can swim, shower, or sweat without a second thought. And it is fully compatible with both Android and iPhone, working easily with your phone to track your progress. I recommend it especially for those who are 40 years and up looking to stay on top of their blood pressure, anyone starting a fitness journey, and those wanting an affordable all-in-one health tracker without breaking the bank. Right now, there is a 10% coupon on Amazon. Just click the link below in the description section, activate the coupon, and grab yours while it lasts. If you buy it using the link in the description section, I will earn a small commission, and that is how you get to support this channel. Your health is your wealth, and the sooner you start tracking, the better your control over your heart health. This watch makes it super easy. Grab one now. But what happens if we increase potassium intake? A meta-analysis of 22 randomized controlled trials found that boosting potassium intake lowered systolic blood pressure by an average of 3.4 units, okay? Systolic is the top number you see when your blood pressure is measured. Even more impressive, when potassium intake reached between 3,500 and 4,700 milligrams per day, systolic blood pressure dropped by an average of 7 units. So the evidence is clear. Low potassium intake is equals to high blood pressure, while high potassium intake is equivalent to lower blood pressure. But here's the next big question. Does this really matter? Does lowering your blood pressure by just 5 to 10 units make a difference in your actual health risk? The answer is a resounding yes. High blood pressure increases your risk of heart attacks and strokes, both of which can be deadly, okay? And the definition of high blood pressure has shifted over time. We used to think that a measurement of 140 milligrams per mercury or lower was acceptable. But new evidence shows that even at that level, risks are significant, okay? A massive trial with over 9,000 participants put this to the test. It asked, If we lower blood pressure to 120 milligrams per mercury instead of leaving it around 140 milligrams per mercury, can we reduce heart attacks and strokes? The results were so dramatic that the study had to be stopped early. Lowering blood pressure to below 120 milligrams per mercury led to a 27% reduction in heart attacks, strokes, and deaths from these causes per year. Because of findings like this, the European Society of Cardiology now recommends targeting a systolic blood pressure between 120 milligrams per mercury and 129 milligrams per mercury with some exceptions. And here is a key tip. The most accurate way to measure your blood pressure is at home when you are relaxed, okay? Not at the doctor's office where white coat syndrome can skew the results. Now back to the original question. Does lowering blood pressure by 5 to 10 units help? The answer is absolutely. A systemic review of clinical trials found that lowering blood pressure by just 10 units cuts the risk of the following: coronary heart diseases by 22%, stroke by 41%, and the benefits are even greater in older adults or those with very high blood pressure. For example, someone who is 80 years old with a blood pressure of 170 milligrams per mercury can experience huge risk reduction with just a small drop in blood pressure unit, okay? So, potassium clearly matters, but how much do you actually need and how can you get it? First, let us quickly review why blood pressure rises, okay? When blood volume increases, pressure against the blood vessel walls increases, much like water in a hosepipe. High sodium intake, mainly from salt, causes your body to retain more fluid, increasing blood volume and raising blood pressure. Potassium works in the opposite way. It helps your body eliminate excess sodium through urine, reducing fluid retention and lowering blood pressure. Ideally, we want to reduce sodium intake, but if that is difficult as often it is, increasing potassium becomes even more important. How much potassium should you aim for? The World Health Organization recommends at least 3,500 milligrams per day. The American Heart Association suggests between 3,500 and 5,000 milligrams per day. Unfortunately, most people don't close to these targets largely because of modern diets. Well, potassium-rich foods include leafy greens like spinach, then we have bananas, broccoli, dry fruits, and salmon. Personally, I prioritize whole fruits, vegetables, beans, lentils, peas, oats, and avocados, which provide not just potassium but also fiber. And here is a bonus: high fiber diets helps with weight loss and overall health. Eating an extra 14 grams of fiber per day can reduce calorie intake by 10%, leading to nearly 2 kilograms of weight loss over just few months. Fiber also cuts the risk of death from heart disease, stroke, and other causes by 15 to 30%. Plus, it helps lower blood pressure and cholesterol. As for supplements, while I include potassium and magnesium in the megavitamin I take, you don't need a supplement to get enough potassium if you eat balanced whole food diet, okay? Just one important note: magnesium helps your body retain potassium. If you are low in magnesium, you may lose too much potassium through urine even if you are consuming enough. So in summary, potassium is a powerful tool for lowering blood pressure. The effects are clinically meaningful. You can get enough through a healthy diet focused on whole foods, okay? But potassium alone isn't enough. There are other key risk factors that must be addressed if you want to truly protect your heart and brain. Make sure to watch this video next year, where I'll break down those factors and show you exactly how to tackle them, okay? Your heart will thank you. Stay blessed and bye.